Picture this. You're walking home late at night. The air is cold, and the streets are empty. Suddenly, a shadow moves. There's a flash of steel, a sharp sting in your abdomen, and then a terrifying warmth spreading through your shirt. You've been stabbed. In that split second, your brain screams at you with a million years of evolutionary instinct. Get it out! Get it out of me! Your hand reaches for the handle, your knuckles turning white. You want to pull it out because having a piece of cold steel inside you feels like a violation of nature. But stop! Right there. That instinct? It's the fastest way to turn a survival situation into a funeral prep. We've all seen it in the movies, right? The hero gets stabbed, grinds his teeth, pulls the blade out with a dramatic grunt, and then wraps the wound in a dirty rag before taking down 10 more bad guys. It's heroic. It's badass. It's also complete and utter medical fiction. In the real world, that knife isn't just a weapon anymore. The moment it entered your body, it underwent a career change. It's no longer an intruder. It's a biological plug. Think about your body as a high-pressure plumbing system. Your heart is the pump, and your arteries are the pipes. When that blade slid in, it likely tore through some of those pipes. But here's the twist. As long as the knife stays exactly where it is, it's actually blocking the very hole it just made. It's a cork in a bottle of red wine you really don't want to spill. The pressure of the blade against the severed vessels is the only thing keeping your life force from decorating the pavement. The moment you pull that plug out, the floodgates open. You've just turned a controlled leak into a catastrophic blowout. And it's not just about the blood. A serrated or even a smooth blade creates a second trauma on the way out. You think you're removing the problem, but you're actually just slicing through the remaining intact nerves and vessels with a double-edged exit. It's like trying to fix a leak by ripping the pipe out of the wall. In this episode, we're going to investigate the brutal fluid dynamics of a stabbing. We'll talk about why doctors call knives accidental tourniquets, why your kitchen knife is a ticking time bomb, and the only 3 words you need to remember if you ever find yourself with an unexpected piece of cutlery in your ribs. I'm Abel, and let's find out why the bravest thing you can do is absolutely nothing. Let's get into the bloody details. To understand why you should leave the knife alone, you have to understand what's happening inside you right now. Your heart isn't just a pump. It's a high-performance engine that maintains a constant, heavy pressure. Think of your circulatory system like a garden hose turned on full blast. When you get stabbed, the knife is like a nail driven into that hose. As long as the nail stays in, you only get a few drips. But what happens the moment you yank that nail out? Exactly. It's a jet engine of red. In the medical world, this is about tamponade effect. The object, the knife, the rebar, the shard of glass, is exerting direct pressure on the walls of the blood vessels it has severed. It's performing a task your body can't do on its own, mechanical occlusion. By pulling it out, you're not just ending the pressure, you're creating a vacuum for a split second that sucks even more blood out of your core. You're literally opening the drain on your own life. And let's talk about the golden hour. From the moment you're stabbed, you're on a ticking clock. If the knife stays in, your internal bleeding is contained. It's messy, but it's localized. The moment you pull it, you accelerate the clock by 1000%. Your blood pressure drops like a stone, your brain loses oxygen, and you go from wounded to unconscious in seconds. You didn't just pull out a knife, you pulled the trigger on your own heart failure. There's also the internal shredding problem. Your organs aren't just sitting still. They move when you breathe and when your heart beats. A knife inside you is already doing damage just by being there. But pulling it out? That's a manual override of the original injury path. Unless you are a world-class surgeon with a robotic hand, you will shake, you will twist, and you will turn that clean puncture into a jagged, unfixable tear. So, the physics is clear. The blade is the only thing standing between you and a catastrophic drop in blood pressure. It's an accidental tourniquet that you didn't ask for, but desperately need. But let's say you're stubborn. Let's say you pulled it anyway. What's waiting for you next isn't just a leak. It's an invisible killer called internal cavitation. Let's find out why the damage you don't see is the one that actually gets you. Imagine a freshly sharpened steak knife. When it goes in, it's a relatively clean puncture, a small, precise incision. But when you pull it out, especially if it has a serrated edge, it's no longer a clean entry. It's a second act of violence. Every twist, every slight angle change, every microscopic tremor of your terrified hand turns that exit path into a wider, more devastating laceration. You're not just removing a foreign object, you're performing an amateur surgery with a potentially lethal outcome. This is called tearing shear force. The tissues and vessels around the blade aren't just cut once. They're torn and shredded as the blade pulls free. This second, often larger wound means more blood loss and a greater chance of damaging adjacent, previously unaffected structures. It's like ripping off a Band-Aid that has been super glued to your skin. The initial sting is one thing, but the tear-on removal is much, much worse. And let's not forget about the vacuum effect on exit. When the knife is pulled out rapidly, it creates a sudden negative pressure within the wound channel. This can draw in air, leading to a condition called air embolism. If that air bubble enters your bloodstream and travels to your heart or brain, it's a quick, silent, and often fatal killer. So, congratulations. You just turned a stab wound into a potential stroke or heart attack trigger. You literally created a bubble of death inside yourself. Furthermore, the act of pulling the knife out can dislodge blood clots that might have already started to form around the blade. Your body, in its desperate attempt to survive, tries to clot the bleeding, but your instinct to cleanse the wound overrides this natural defense mechanism. You're actively sabotaging your own body's first line of defense, turning a struggling hero into a helpless victim. So, the knife isn't just a simple object. It's a complex, multifaceted instrument of destruction. It goes in, plugs the hole, and then, if you pull it, it tears, shreds, and sucks the life out of you. The advice from every medical professional, every trauma surgeon, every combat medic is always the same. Leave it in. But what if you're alone? What if help is hours away? There are still some things you can do. Let's look at the immediate first aid that actually works. So, the knife is in. You've successfully fought the urge to yank it out. Now what? You can't just stand there and whistle. Your goal now is to turn that accidental plug into a stable plug. Every time that knife moves, even a millimeter, it's slicing new tissue inside you. You need to immobilize it. Think of it like a fragile artifact that needs to be created for transport. First, sit or lie down. You need to lower your heart rate. A racing heart pumps blood faster out of those internal leaks. Then, you need to bulky dress the wound. Don't press on the knife, press around it. Use clothes, towels, or whatever is clean and thick. Build a padding tower around the blade to keep it from wobbling. You want to turn that knife into a statue that doesn't budge, even if you're being tossed around in an ambulance. If you have tape or a belt, use it to secure that padding. Your mission is simple. Keep the knife from moving relative to your body. If the knife moves with your skin, it's not cutting your organs. And for the love of everything, do not try to clean the wound or apply antiseptic into the hole. You're not a janitor. You're a survivor. Leave the cleaning to the people with the PhDs and the sterile theater. While you wait, stay warm. Blood loss leads to hypothermia, and cold blood doesn't clot as well. It's a vicious cycle. Wrap yourself in a jacket or a blanket. Keep talking to yourself, or stay on the line with the dispatcher. Focus on your breathing. Slow, deep, and steady. You're essentially putting your body into a low power mode to conserve every drop of your red fuel. It takes an incredible amount of mental strength to look at a blade in your chest and decide to let it stay there. But that mental strength is exactly what saves lives. You've done the physics, you've done the math, and you've stabilized the trauma. Now, let's wrap this up with the final verdict on why doing nothing is the most productive thing you'll ever do. You've done it. You kept the knife in. You stabilized the wound. And the ambulance has finally arrived. Now you're in the ER, surrounded by people who spent a decade in school for this exact moment. You might think, okay, now they'll just yank it out, right? Wrong. Even for them, that knife is a ticking time bomb. They don't just pull, they prepare. In the operating room, they won't remove that blade until you're under anesthesia. Your blood is cross-matched for a transfusion, and the surgeon has their hands literally ready to pinch your arteries shut the millisecond the metal leaves your body. They use imaging like CT scans to see exactly what that knife is touching. They turn an unpredictable disaster into a controlled surgical procedure. They have the plug replaced by a $1,000 medical clamp before the first drop of fresh blood can even hit the floor. So, let's recap the bloody physics we learned today. 1. The knife is a biological plug. Removing it opens the floodgates. 2. Pulling it out creates a second trauma that's often worse than the first. 3. Rapid removal can suck air into your veins, creating a lethal bubble. And 4. Your only job is to be the world's most stubborn statue until you reach the hospital. Movies love the drama of the heroic extraction, but in the cold, hard reality of trauma medicine, the real hero is the person who has the self-control to leave the weapon exactly where it is. It takes guts to stay stabbed. It takes brains to ignore your instincts. You are the manager of your own survival. And sometimes, the best management is to not touch the controls. If you ever find yourself in this nightmare, remember, leave it in. Stabilize it. Get help. I'm Abel, and thanks for sticking with me through this sharp turn in medical science. Go live a life that doesn't involve unexpected cutlery. But if it does, now, you know what to do.